Shifting gears here, millions of adults and children have been diagnosed with attention deficit disorder, and that number has only grown over the past decade. Joining us now to discuss is Dr. Carole Lieberman, board-certified psychiatrist. Dr. Lieberman, great to have you with us today. So what does the diagnosis for ADD or ADHD actually entail?
Well, ADD, attention deficit disorder, relates to children, and mainly it's diagnosed in children, first at least, and it has to do with children who have problems keeping attention, maintaining attention. They get forgetful. They are particularly bad at doing things that take sustained attention. It all relates to attention. Attention deficit hyperactivity disorder is really easier to diagnose because these are kids who not only have attention deficits, but they are also often climbing the walls in class. They can't sit in their seat. They fidget a lot. They interrupt. They talk over you. So these are the kids who get attention most easily. But the APA, the American Psychiatric Association, has done studies that show that the prevalence of ADD and ADHD is really only 5%. But at least 11% of people are getting diagnosed with it. In other words, it's getting overdiagnosed. And the problem with that is that when it gets diagnosed, a lot of doctors, instead of just concentrating on treatments like behavior modification and so on, they give medication, they give stimulants, and those can have side effects.
So if you are an adult, you think you might have some of these symptoms and you consider that overdiagnosis, when should an adult consider talking to their doctor about getting tested for this condition?
Well, adults and children should really have psychological testing before they begin any kind of medication for it. There are specific tests for kids and adults that can tell you whether you have ADD or ADHD. The problem is that there are things that can mimic it, where a doctor can make a mistake and think that you have one of those, and really it's something else. Like, for example, it could be manic depressive disorder. It could be anxiety. There are other psychological problems that can, at first glance, seem like this. So you really shouldn't just as a child or an adult, shouldn't just quickly jump to stimulants.
So if you have been diagnosed and treated for ADD or ADHD as a child, is it possible for the condition to go away in your adulthood?
Well, there's a genetic component to it, and that doesn't mean that anybody who has a person in their family with this will get it. There are lots of environmental issues, whether you have a lot of stress in your environment, for example. And so, the symptoms, if you've been actually diagnosed as a child, accurately diagnosed, it is possible for the symptoms to change shape as an adult if you have found ways to compensate for it. For example, if you have found ways to organize your work, or, for children, it's schoolwork, and adults regular work, if you found ways to compensate by organizing things better with colored pencils, for example, or whatever works for you.
Mm-hmm. And you mentioned that stimulants are often a treatment for ADD or ADHD. What are the side effects of those drugs?
Well, there are side effects while you're taking the drugs. In other words, at the moment, at the time, right away, you get to see these. And these can be things like moodiness, decreased appetite, decreased sleep, even can stunt your growth for a child. And then there are long-term consequences, notably cardiac consequences, high blood pressure, for example, arrhythmias, and then the most serious side effect is they have found that children who get these stimulants, these stimulants are addicting. And if they have found that when children grow up, in addition to the stimulants that it's hard to get off of, they become more easily addicted to other drugs. And of course, that is a whole other problem in itself. So you have to be really, the main point that I'd like to get across is you should be diagnosed, first of all, by a psychiatrist, not a family doctor. And you should ask to have psychological testing. and you should rule out any other possible psychiatric problem.
Those are good pointers, but given the side effects of stimulants, are there any natural ways for those with these conditions, ADD or ADHD, to improve their focus without the help of stimulants?
Yes, like I began to say, or parents can help their kids organize better, and they can help their kids by giving them a lot more time to study rather than, everything being crammed at the end. But there are all different ways you can find out whether your child learns better by the written word or visually, video kinds of things, or listening to things, and just helping them to organize is the main thing, and giving them short periods of time to study rather than expecting them to be able to concentrate for each child it's different, but like a half an hour or an hour, that's way beyond what most kids can do. And also, it's important to positively reinforce children when they do good behavior rather than punishing them all the time for things that they do, that, climbing the walls, for example, if they have this and they really can't help it.
All right, great advice all around. Dr. Lieberman, thank you for your time. That's Dr. Carole Lieberman, board certified psychiatrist.